Welcome everyone to Sofwave's live webinar. We appreciate each and every one of you for joining us this evening. Now, for those of you who are new to Sofwave, Sofwave is an FDA cleared technology that's needle-free with proven results for lifting the skin and for the improvement of wrinkles, as well as the improvement of cellulite. Tonight, we have an esteemed panel of physicians, and I'd like to make some quick introductions. Dr. Mara Weinstein is a board-certified dermatologist and director of cosmetics and laser surgery at the University of Rochester in upstate New York. Dr. Brian Hibler is board-certified and Harvard fellowship-trained dermatologist at Swiger Dermatology Group in Midtown Manhattan. And finally, Dr. Nazanin Saedi is a board-certified dermatologist, and she serves patients in the Philadelphia and the surrounding area. She's a clinical associate professor at Thomas Jefferson. So, Dr. Hibler will start us off tonight.
Hi, good evening, everyone. Thank you, Carolyn. Thank you, Kim, for having me. I'm so excited to be a part of this outstanding panel here to share our experiences and some insights regarding the Sofwave technology. So first, we're going to take a dive into a little bit behind the science and the technology here. So this is a high-level overview about Sofwave. When I practice in Midtown Manhattan, and my patients want treatments that are going to give them results with little to no downtime, that are non-invasive, that are safe and effective. And Sofwave is really delivering on all of these aspects. It's used for wrinkle reduction and lifting of tissues of the face and neck, completely non-invasive to help build collagen and elastin. And a lot of patients get this lifting effect and they get some tightening and more elasticity and bounce to the skin, which is very exciting. It utilizes ultrasound technology, and we'll talk a little bit more about this later in the slide deck. So it bypasses the epidermis. There's integrated cooling to protect the epidermis so that you get the heating deep under the skin. And that's what makes it safe for all skin types. We call this a colorblind treatment, so safe in all skin types. A treatment of the face and neck takes about 30 to 45 minutes, essentially no downtime with the treatment, and gives long-lasting results. It has broad FDA clearances. It's used to improve facial lines and wrinkles, lift the eyebrows, which we'll see some very nice before and after pictures of, lifting lax skin of the neck and submental area. So I'll often combine this with injectable lipolysis treatments after we reduce the fat to get a little bit more tissue tightening and enhance the jawline. And it's also recently approved for the short-term reduction of the appearance of cellulite. So now we're starting to explore this technology on the body, off the face. So what do patients want? They want a non-invasive treatment that's safe, effective, and consistent, and that's quickly performed in the office. Again, this is a colorblind treatment, safe in all skin types. We use topical anesthesia, at least in my practice, for patient comfort. And if you look at the module, the interface on the device there, you just see a couple numbers at the top. It's incredibly simple and easy to use. You essentially just need to control the energy that you're utilizing. The pulse duration is pretty standard and the cooling that you use. So really, in my practice, I'm really only controlling one variable, which makes it very simple to use. It has a high return on investment, quick payback, very safe treatment. Again, easy to maintain, use, and learn. And I have not had any patient issues to date with this device. So what is this superb technology? This is synchronous ultrasound parallel beam technology. Again, it's ultrasound technology for deep heating of the mid-dermal tissue to build new collagen and give you that lifting and tightening effect. It's a very simple, intuitive device. We'll take a closer look at the handpiece. So it's a very quick treatment. And again, it has this integrated cooling mechanism so that you protect the epidermis during the treatment, which is integral. It really provides a safe treatment and results in no downtime for the patient. So on the right, we have a figure of the handpiece, and there's 7 cylindrical transducers that emit the ultrasound energy concurrently all together, and they target a precise depth at 1.5 millimeters under the skin. So again, the epidermis is completely spared and cooled. You get this deep heating, and it really has been proven to be the optimal thermal dose of a pulse duration of about 4 to 5 seconds, where you're heating that subcutaneous or mid-dermal tissue up to about 60 to 70 degrees centigrade. And then you make multiple passes over the tissue. And if you see how the different transducers are all aligned there next to each other in a parallel array, you really cover a broad surface area of the skin, which allows you to get the treatment done in only 30 to 45 minutes when you treat the full face and neck. So it's a very safe, controlled treatment and very quick treatment. And then we'll take a look at the histology later at what this is doing underneath the tissue. So again, high volume coverage. Here we see the handpiece again with the 7 transducers. It's a very unique array and creates these cylindrical shaped thermal zones we'll see on histology, all parallel. And the soft cool is that technology we were talking about that provides precise feedback during the treatment that there's good contact and appropriate cooling to protect the epidermis and protect the patient. Now this is a newer handpiece, and this one is smaller. This is the precise applicator. So instead of having 7 transducers, we have 3 on this one. And this smaller handpiece makes it easier to treat the periorbital skin and the perioral skin. So areas where there's a little bit more concavity or roundedness to the skin, and you want to have good apposition of the transducers and the handpiece, good contact with the skin. So this allows you to treat right up around the eye on top of the orbital rim. And we've seen some really incredible results in reducing the wrinkles in this area. And again, with no downtime, which is really a game changer in my practice. This handpiece also has that soft cool technology for patient protection.
Thank you, Brian, for an amazing introduction. Thank you, Kim and Carolyn, for having me participate in this wonderful panel with my colleagues. So let's get a little bit into the science of what's happening after those ultrasound waves heat that deep, that mid-dermal tissue, as Dr. Hibler mentioned. So we've all heard this, but in younger skin, we have tightly, nice arranged collagen fibrils. You can see that the epidermis is nice and smooth. There's no wrinkling there in young skin. But as we get older, there is a 60% reduction in collagen levels by the age of 60. In fact, we lose 1% of collagen every year of life. And then in as early as our 20s, our elastin production stops, which we don't talk about a lot, but it's should be on our radar because we'll see moving forward that a device like the Sofwave can help recreate that elastin and get some bounce back to the skin. So in the older skin, we see sagging, loss of volume. But if you really look at that graphic, you can see that the aging skin, so there's undulations or wrinkling in the epidermis. And then those collagen and elastic fibers are very fragmented and just kind of messy in our extracellular matrix. So the beauty of Sofwave is that we'll see on histology how it sort of rearranges all of that to get it back to where it was in that younger skin. Next slide. So the mechanism of action. So as Brian talked about, we'll just go a little bit into this. So what it does is deliver thermal injury to the dermis, which induces generation of new collagen, elastin, and actually hyaluronic acid as well. And so that energy penetrating into the skin creates that isolated zones of injury in the dermis, leading to an inflammatory wound healing response. This stimulates growth of new elastin and collagen and induces long-term tissue remodeling, which leads to skin tightening and wrinkle reduction. Now, we know the optimal treatment parameters requires heating the thermal injury zones in the dermis to a temperature of 60 to 70 degrees Celsius at that fixed depth of 1 to 2 millimeters. The Sofwave device delivers those thermal zones of injury at that fixed depth of 1.5 millimeters. And then an optimal treatment requires no epidermal damage, which is why we hone in on that cooling effect of the device, which is so important. Now, all of this science has been extensively validated, both from a basic science animal model to human studies. There have been a number of in vitro studies validating, the temperature distribution of the skin, predicting the volume of collagen denaturation, thoroughly examining the transducers and the way that they function under the skin, in vivo animal models to validate tissue response. And this all translate to human studies, which sort of led to those FDA approvals, which we've spoken about a little bit. The first human feasibility study was actually back in 2017. Which led to that first FDA approval, which was for wrinkle improvement. And then as you can see on the slide, the FDA approvals just keep coming, with the most recent being to treat cellulite, which was back in 2022. So here's an in-depth look at those transducers. You can see the depth has been optimized for skin tightening by both the time and temperature. They're directional. The The columns are directionally placed as parallel beams to create a unique thermal injury, elongated and parallel to the skin surface. There's a lot of coverage, the largest in the industry. As you can see, those 7 thermal transducers are delivering, and then we do a bit of cross-hatching, which we'll go into in terms of technique. And then with regeneration, really, we're seeing new dermis created, new collagen, new elastin, and new hyaluronic acid. So the thermal injury to that kind of messy extracellular matrix that we saw at the beginning at that temperature, that key temperature between 60 to 70 degrees Celsius, sets off this inflammatory cascade. So cytokines are released, which start that wound healing process, which then point macrophages are recruited, which removes that damaged tissue to allow space for new collagen and elastin to grow. And then ultimately fibroblasts are stimulated, and they can differentiate into collagen, elastin, and hyaluronic acid. So we see on the left baseline images of what just skin looks like. You can see that up top, the epidermis is pretty thin. If you look to the far right, where the H&E staining is shown, we see baseline H&E images showing fibroelastosis of the dermis. To the image on the right was taken 10 months after treatment with Sofwave, which shows these thickened eosinophilic collagen bundles. You can really see that nicely around the hair follicle as well. To the next set of pictures looking at hyaluronic acid are stained with Alcian blue. At baseline, you can see sort of kind of like a messy blue depiction of some hyaluronic acid, of that elastotic dermis. And then 10 months later, especially around the hair follicle, you can see that nice Alcian blue kind of light up, which indicates development of increased amount of HA. Another set of biopsies here, just highlighting the way that this procedure can help regenerate collagen and elastin. These show to the left baseline images of collagen and elastin, and then when stained with Una Taser, we can see that there's an increase in elastin, which is stained red, at 10 months after one treatment, and increase in collagen, which is stained blue. And then the pictures to the right, which are more pink, kind of stand out, are stained with this elastic stain. And this elastin appears dark in the far right picture, which is 10 months after one treatment. So just a histology to show the true increase in elastin and collagen after just one Sofwave treatment. And these are 10 months later. And then lastly, we can look at the Mason trichrome staining, which really highlights those collagen bundles. So if you look on the far left, the baseline picture, there's really a lack of blue collagen fibrils in the dermis. And then on the right, you see an increase in those collagen fibers, which shows regeneration of collagen type 3, which you could see in the blue on the right. This is a Mason trichrome staining, which basically highlights your collagen increase. And so now we can look at some clinical images highlighting the effects and the benefits that Sofwave can have after just one treatment. We'll talk a little bit more about our protocols in the next section, but this was just after one treatment. Really nice improvement in softening that submental area in the neck. Next slide. Again, after one treatment, this picture was taken at baseline and then 12 weeks follow-up. That is also when I take my follow-up pictures at about 12 weeks. We have a patient come back and assess their results and then actually discuss at that time if they'd like another treatment. Next slide. Again, really nice improvement here along the jawline and neck. The neck laxity has improved significantly, and this was 11 months follow-up. Great. And so now I'll pass it on to my friend and colleague, Dr. Saedi.
So we'll talk about the clinical evidence. And what's really great about Sofwave that I think distinguishes it from other devices in this category of skin tightening is that there's a lot of real science behind it. Mara talked about the animal studies, but there are also extensive human studies for all of the different indications. And if we go to the next slide here, we can see that all the different indications that we have through the FDA trials for wrinkle improvement, brow lifting, laxity in the submental region, and the most recent approval was for cellulite this past December. This slide just highlights these FDA studies, and we'll show clinical evidence of improvement in all of these areas and go into a little bit more detail about cellulite, because this is an exciting new application. And I want to emphasize that it's indicated for short-term improvement of the appearance of cellulite, and we'll launch into details about that. So if we can go to the next slide, please. The pivotal trials for wrinkle and facial lines have shown an 86% reduction in 1+ in the Fitzpatrick wrinkle elastosis score and 78% wrinkle reduction by a blinded evaluator. Those are some really high, impressive numbers. Then when we look into the pivotal studies, looking at brow, laxity in the submental region, and neck lifting, the rating was that there was about 85% lift in the lax submental area and neck lift, according to physicians' grading. 80% have an eyebrow lift, and patients in our practice love this about the device. 80% have lax and submental neck lift, according to the blinded reviewers. And about 79% have an eyebrow lift, according to blinded evaluators. In the short-term improvement of cellulite, 89% improvement was both for rating the cellulite and for the skin laxity. And we'll show you those images. So if we can go to the next slide, please. And these are just some extensive studies that I'm not going to list, but as you can see, the safety and the efficacy of this device has been shown for all of these indications by some really spectacular dermatologists around the world. So let's take a look at some before and afters and see what kind of results people are seeing. So this is a patient of Dr. Gili Munavalli, and I really commend all of the physicians whose photos we're going to review, just because it's really hard to capture skin laxity. And it's so important to take photographs that are reproducible and the angles are consistent in the before and after, because so much of what we see, especially in social media, is a lot of practitioners kind of manipulating their before and afters. So people might look like they have these incredible afters, but if you look, the angles are different. So take a look at how this is all scaled in the background. But if we focus in on this patient, she has a really great result along her jawline and her neck laxity. We can go to the next slide. This is a patient of Dr. Munavalli's as well. And yes, she still has laxity, but 9 weeks after single treatment without having surgery, this is a pretty incredible result. And we all have these patients in our practice. If this woman came in, I would send her to see one of my surgery colleagues. But the reality is not everyone can afford it, and not everyone wants to undergo those risks. So she had a fantastic result, both along in her submental area, along her jawline, and in her neck. We can go to the next slide. Here is a gentleman. Yes, men do these procedures too. And I find this to be one of the most easy procedures to talk to men about, because there's no downtime. No one has any idea what you've done, but you just look better as a result. And here we can see that with this gentleman. You can see an improvement along his nasolabial folds, along his jawline, and somewhat along his neck as well. We can go to the next image. This is a patient of Dr. Munavalli's again. And if you take a closer look, what you can really appreciate is the improvement in her skin texture. We have the histology that Mara went over, showing the changes in collagen and also elastin. And here is one where you really see an improvement in the elastin, and her elasticity looks better. And she has nice tightening along her jawline and some definition that she didn't have prior. We can go to the next slide. And here you can see a nice improvement along the jawline as well, improvement in the submental laxity, more definition, 12 weeks after treatment. And like Dr. Weinstein, we have patients come back at the 12-week mark. They can see the difference and the improvement in their skin and in the skin laxity. And then we assess whether or not they need another treatment. We typically recommend 2 treatments, but some people are happy after 1. We can go to the next slide, please. And then if you take a look at this patient, you can see that her brows are lifted. She has less laxity or less skin laxity on her eyelids. You can also see an improvement in the skin laxity around her eyes. These newer hand pieces make it easier for us to treat the area under the eyes and to get closer to the lid margin and to get more tightening. We can go to the next slide, please. And here again, you can see an improvement. This patient's eyes appear to be opening up because she does have some lifting in the brow area and her eyebrows are lifted. So if you just take a look, her eye size seem wider and more open. We can go to the next slide, please. And then here's a patient of Dr. Geronimus's. And what you can appreciate here is a little bit more definition in her jawline. She didn't really have much definition before because there was so much laxity. And here you can see an improvement in her jawline. Next slide, please. Here again is improvement in her submental area, and you can see an improvement in her laxity along her submental space and also on her neck. And if we can go to the next slide, and then this is just like a striking improvement in this patient's neck and submental area. Again, this is a patient who would probably benefit from surgery, but got a great response after treatment, and this is 16 weeks out. This is another patient who had improvement along the jawline. If you look at the before photo, this patient, again, didn't have much of a defined jawline, but afterwards, you can see a big improvement along her jawline and also in that submental area. The submental laxity is pretty profound in her before and also in her neck as well. The necklines are less pronounced and she has much less laxity. Next slide, please. And this is a striking photo that Mara had shown of the whole face, but if we just zone in here on the neck, it's really significant improvement of the skin laxity in the submental area, also along her neck. She had a lot of redundant skin and a lot of laxity that has since improved 16 weeks after a treatment. And this is again, improvement on the neck. I sound like a broken record talking about improvement along the neck, but the thing is, like, it's really hard for us to capture these images appropriately with standardized before and afters. And here you can see everything is perfectly standardized. You can really appreciate a difference 12 plus weeks out from a single treatment. We can go to the next slide. And this is a younger patient who has necklines. So many of the younger patients that we see have tech neck just from constantly looking down on screens and looking down on their phones and iPads. So they've developed these horizontal creases and then the tech neck and laxity a lot earlier on than some of our older patients. And this is a great treatment option for them to improve the laxity on their neck. You can go to the next slide, please. And then I wanted to, in the last few minutes, just kind of hone in on cellulite. So with the cellulite FDA pivotal trial, there were 2 blinded reviewers that assessed pre and post photos. And for a lot of cellulite studies, some of the blinded evaluators actually can't tell the before, the after from the before. And what they found was that there was an 89% improvement for both cellulite, the appearance of cellulite, and the appearance of skin laxity. And if we look at some of these photos, we can appreciate both the appearance of cellulite and laxity in the photos. So if we can go to the next slide, please. This is a patient of Dr. Gilly Munavali's. And if you look at the area treated, it's nicely marked out. Is the cellulite still present after? Yes. And we expect it to be present after, but there's an improvement and it's softer in appearance. This also shows that even with standard photography, it's still hard to capture improvement in cellulite, but we can appreciate an improvement in the appearance of cellulite and the laxity here. We go to the next slide, please. This is more, this is better imaging showing the depressions and really capturing it. And here you can see that in the treated areas that there is an improvement and an elevation in the depressed area. So the dimples are less pronounced, and we can see it by this imaging capturing system. We can go to the next slide. And here, if we zoom in, you can see an improvement. It's hard to see it clinically, but if you zoom in, you can see that there is a reduction in the appearance of cellulite here. And if we go to the next slide, in patients who don't have as pronounced cellulite, you can see the improvement more. In those other photos that we had shown, there was a lot of cellulite present. And even though you get a reduction, it's still hard to see it, how much has improved. But here in a patient who has milder cellulite, you can see that it does look significantly better after a treatment. And how does this compare to other technologies? I had mentioned that there's a lot of science behind it. It's also well tolerated. A lot of the devices that were using before for tightening had downtime, especially the ablative and the fractional ablative devices. The RF microneedling devices oftentimes didn't hold up to what they promised. And the superficial high intensity focused ultrasound just hurts so much. So there comes the technology of Sofwave with the superb technology. And if we were to compare to non-ablatives, non-ablatives just don't do as much as this does for tightening and for dealing with laxity. If we go to the next slide, that really hones in on the difference between the high intensity focused ultrasound versus the superb technology. And this is a question that patients often ask us, and also practitioners who are looking at different devices. Well, what's the difference? I might already have one of the competitors. How does this pair up? And the truth of the matter is like Dr. Weinstein discussed and Dr. Hibler discussed, this is treating a much larger area. The technology is different. It's a much higher volume of coverage, and we're going more superficially. So there's less risk of causing harm to underlying tissue. And that's also why we see fewer side effects, and these treatments are tolerated so much better. So if we can go to the next slide. We'll turn it back over to Dr. Weinstein to talk about return on investment and marketing.
All right. Yeah. So I'm really excited to talk to you about some of these key points because, so I'll just give you a little background. We've had the Sofwave for about almost 4 years now. I'm in a university setting, so it's not always easy to get devices, and we were able to get our hands on this device pretty quickly in the middle of 2020, which was kind of a godsend to our practice because it's been a game changer, really. We're the only office in Western New York with the device, and patients have flooded the office to get treated. So that said, there is a huge ROI. This is a slide showing what the ROI would be with a leasing plan. So if you have questions specifically on this, you can target those to the Sofwave representatives at the end. Next slide. But Sofwave has done a really great job of highlighting their treatments and their physicians and their KOLs and social media. You can see just in 2023 how much it's grown. There's a few posts from my IG page there, and it's a really nice way for us to display our results and have patients kind of speak to the efficacy of the treatment and just to their satisfaction. Just from these posts, I've had patients come back wanting more, asking questions like, I didn't know I could get another treatment. And in our first cohort of patients a few years ago, we were saying, one treatment every year, because the first clinical trials were, just that. And now we've seen that treatments sooner, maybe every 3-6 months, can be more and more helpful. They're really cumulative. So in our older patient population, those patients especially want to get more and more treatments. And they've just been really happy. So I'm grateful for social media for that. Next slide. So Sofwave has also done a really good job of expanding patient awareness. Just as I mentioned, in addition to social, they're doing a lot of online placements, a lot of broadcasting on networks, putting editorials out there. I saw a really nice article, which I think is posted or shown here in Birdie, just a patient kind of going through her treatment. I think it was an editor actually talking about her treatment and showed some pictures. And those things have real impact on our patients because they will bring in the physical article and say, like, what is this? Do you have it? And if you don't, where can I find it? Again, so in the news, so now print media, they've done a really nice job of just getting the word out there. And so more and more consumers, patients know about the treatment and know that there's an alternative. This was an event that Sofwave held in Beverly Hills with an influencer. And it's just showing how much their Instagram or their social had grown after this event. That is an incredible number there. So the other thing that's great about Sofwave is that they make it really user friendly. So once you have the device, there is a consumable, there are pulses that you have to sort of refill, and there's a certain number of pulses that you can use or that you might use per patient. And then when the pulses run out, you can refill them. And they have this really nice platform called the Sofwave e-store. It's available 24/7. Once you get the hang of it, it's really easy. You can just kind of plug and go, and then you enter in a code on the Sofwave itself, and the pulses refill. So there's no waiting for mail or shipments or hand pieces or caps or anything like that. It's all done electronically. And then there's a PulsePal Awards loyalty program. So as a Sofwave user, once you purchase the device, there is ways to get your points back. So you can submit before and after pictures, submit a patient testimonial, treatment videos. There's lots of ways to kind of earn more points. And those are really nice to use on staff, friends and family. Just the more people you treat, the better. The more photos you have, the more outcomes you can share. There's ways for the patients to earn money back as well. And if you have more specific questions, we can go over that with the team a little bit later. So lots of awards and online validation. This is what we want to see with a home run device. This device has been a game changer, like I said, in my practice. And there you have it. They're getting the awards and are validated online. So why is Sofwave unique and superb? It's consistent, right? So we see now, patients of all skin types. I think most of us do in our practices. And there's very little risk because it treats all skin types. It's colorblind. There's no aftercare. Patients love the fact that they can just hop out of the office and go back to work or their daily activities. It's a quick and easy procedure. It's also one that is delegatable. So I don't do many treatments myself anymore. I've trained my nurse to do them. She loves them. She's so patient, great with the patients. And so this is a really easy treatment to train somebody on. There's no screen or ultrasound monitoring, anything like that. And of course, it's proven. It's been cleared by the FDA for multiple conditions, not just coagulation. And you've seen us go through all the before and after. So we're looking forward to taking your questions. So in summary, you can read through these pointers that we've gone over, but it's, there's extensive scientific evidence validating its use and function, its safety and efficacy. You've seen the outcomes, FDA cleared for all these different indications. You could have one single treatment. With 2 passes, you get 28% coverage. With 3 passes, there's 43% coverage. There are 4 FDA clearances. There's an 80% eyebrow lifting effect. What we didn't talk about was the lifting effect for the lip as well, but that's just something we've seen in our practice. It's not out there yet, but it does a really nice job with that lip flip. There's an 84.5% lifting effect for submental and neck, 86% reduction in the appearance of wrinkles and skin quality, like Dr. Saedi mentioned. and an 89% improvement in the short-term appearance of cellulite, which is really, really exciting. There's 288 plus study patients treated for the FDA clearances and more studies on the way. So if we haven't excited you enough, I hope we can by answering some of your questions. Thank you so much for your attention.
Thank you, doctors. And let's get right to the questions. We do have a few. Okay, the first one is, are there any contraindications with Sofwave? And the second part of that question, can this treatment be done with Botox and fillers?
So the contraindications to treatment are if there's any active open wounds or lesions on the face or the treatment area. So I would avoid treating over any area that's going to have an impaired wound healing response. In patients that have severe or cystic acne, they're currently studying the device for other indications, but as of right now, I would avoid treating over any area that's got a lot of active inflammation. And then lastly, if patients have any electronic implantable device in the treatment area that you're going over, that would be another contraindication. In terms of combination treatments, like treating with botulinum toxin fillers, in my practice, I will do botulinum toxin before I put on the topical anesthetic, which I'll let sit for an hour. So I feel like that's an appropriate amount of time to allow the toxin to bind to where it needs to be before I go over the areas. But if at all possible, I will try to space it out and do it on a separate day. And I don't do fillers on the same day as the ultrasound treatment. For me, it's a big enough procedure that they're undergoing. I would like them to space out doing that and fillers on the same day.
Moving on, some of my patients don't want multiple treatments or downtime. Have you seen that this is a big sell for Sofwave?
Yes. I mean, I think that for a while, people didn't mind having downtime and we weren't as social. So no one minded doing, like I was doing more full resurfacing than before, but now people mind downtime. Again, people are social, they're out and about, and they want to come into the office, have something done, and maybe not even tell anyone they did anything, but have it not affect their life.
Okay. What is the big difference between this device and Ultherapy?
It's a lot.
Oh, right. I like that one figure that you showed where with HIFU, it's really focusing all of the ultrasound energy at a single focal point. Whereas with Sofwave, it's really the breadth of coverage and the volume of coverage. So we saw how much percentage of the tissue is actually treated with each pass over the skin. And so I think that is why I'm seeing such incredible results, is really that breadth and the volume of treatment area with the 7 parallel transducers and the way that they're firing kind of at the same time. So I think it really comes down to the breadth of coverage.
And I'll just make a quick note about Ulthera versus Sofwave. It's also much, much more tolerable Sofwave than Ultherapy, which is very painful. So that's a huge advantage.
Yeah, it's much quicker.
It's much quicker. And then I was just seeing a question that was asking about Ultherapy and fat loss, facial fat loss, and have we seen this? And no, because it's not going as deep. There's so many more side effects with Ultherapy and reports of nerve damage because you're going so much deeper into the skin and there's a higher risk of causing harm and getting things like facial fat loss, but not with Sofwave, not at this depth.
Speaking of comfort, what do you do to keep your patients comfortable?
I do topical anesthesia. We've got a compounded 23% lidocaine, 7% tetracaine that we use in our practice, or 30% lidocaine. I'll use that for an hour prior to treatment. And then vibration device, little ball to squeeze, talk aesthesia, music. I get the patients through the treatment. With one patient, I did use nitrous oxide. We do a Pronox in our office. I've never had to do a nerve block or anything more aggressive to get the patient through the treatment. And it's really during the 5 seconds of heating, they feel it kind of ramp up and then it instantly cools. So as long as they can tolerate that second of really feeling that intense heat before you move to the next area where you're delivering the pulse, they can get through it. There's also some other techniques as you go along, starting in certain areas that are a little less sensitive so that they kind of get used to that heating sensation before you treat over some areas that are a little more sensitive, and then going away from them and starting to treat in another area again. I don't have any issues getting my patients through the treatment.
Okay, nice. How does it compare with microneedling? Who wants to answer that one?
I think of microneedling as you're treating the epidermis, and you are getting a little bit into the superficial dermis. So, with microneedling, you're going to clearly have downtime. You're going to have more redness, pinpoint bleeding, crusting. I think of it as a little bit different because I think with the heating, you're getting more of a wound healing response. So I think that the way that the thermal damage induces the new collagen stimulation is a little bit more intense than just poking holes in the skin with a microneedling device.
How long do you wait before you bring a patient back to take after photos? What's the best time frame?
Yeah, I usually wait about 12 weeks. And that's what the study showed. And that's usually when the patients have the maximum benefit from the procedure.
Where are you seeing the best results? The brow, the neck, the face, under the chin?
All of them, like everything.
Yeah. What I love about this device is the versatility. So, I've got patients who have had other injectables, fillers, but they want lifting and tissue tightening without more filler. So then we do it on the face. Or they've got some brow heaviness, we do it up above the brow. If we're reducing the submental area, if they've got some fat there and they want to contour the jawline, I'll do some injection lipolysis, something to address the fat. And then I'll use this to tighten the skin afterwards. So there's so many different ways that you can combine it with other treatments. And I think the fact that now we're exploring it off the face, we're using it for cellulite, and I'm sure we're going to be seeing more if we're using it on other body areas, the arms, legs, chest, etc. That when you think about acquiring a device, you really want something that's versatile. And I've seen great results in each of these body locations.
Okay. And do you have to use caution when treating patients who have melasma? Has this ever been a problem, or have you guys seen that?
I've never had a patient have a problem. I think with the integrated cooling, putting ultrasound gel on the surface of the skin, we know that the epidermis is spared from that heating. So I think with that integrated cooling, I have not personally seen any patients have a flare of melasma after treatment.
Okay, great.
I agree. I'll just chime in too that the heat doesn't linger. It's not bulk heating like radio frequency. You feel the heat and then it dissipates. So it's not a lingering, lasting heat feeling. It heats and then cools. So when you think about heat aggravating melasma, we're really not getting that effect here with Sofwave.
Okay. How many passes are you typically doing? Are you doing 2 passes, 3 passes? What's your protocol?
There's some guidelines for recommended treatment settings in terms of energies and number of pulses per treatment area. And so, for example, I'll do about 40, maybe 50 pulses on one side of the face, and it kind of depends upon their facial shape. But what I'll do is I'll first do some horizontal vectors, and then I'll do some vertical vectors so that I'm really getting as best of coverage as possible. And I'll keep making passes back and forth, up and down until I hit that goal number of pulses. And in my experience, I've had really nice results with that.
Do men get this treatment? Have you guys treated a lot of men in your practice?
Yeah.
I have. I think that the men who are timid about injectables like fillers, but they want to address kind of the jawline, some early laxity, some jowling, or when I'm treating submental fullness or they're bothered by the laxity on the neck, they want to get a little bit of tightening and they don't want anything that's invasive. They don't want any downtime so that others don't know that they had a treatment done. It's a great treatment for them.
Thank you, doctors. And we enjoyed hearing more about Sofwave and your perspective. And thank you to everyone who joined us online for your questions. If they weren't answered here, we want to let you know that we will get back with you individually, and we'll also send a recorded version of the webinar. So thank you again. And
thank you.
Have a great night.
Thanks, guys.
Thanks
Bye.
so much.
Good night.
Thank
Bye.
you.